And now we will move on to some deeper structures in the brain. Okay, the first one, basal ganglia. Basal ganglia is considered to be the, so first we will see the cerebral cortex. Okay, cerebral cortex, which is the outer part of our brain. Okay, but it is having a most important role, and in the spinal cord the gray matter is inside, the white matter is the outside. But in case of brain, you have gray matter outside and white matter inside. Why? Because this brain is the one which is having a major relay center. So all the neural signals, neural structures will be present in the cortex. Okay, and whatever nerve fibers which is coming from the cortex will be in the deeper past. So the cortex will have all the neurons. Okay, from those neurons you have the nerve fibers which is coming into the deepermost part where you have the white matter. So white matter is the nerve fibers, gray matter is the neurons. Okay, so in the cerebral cortex the basic structure is you have the frontal lobe, anterior, and occipital lobe in the posterior most. And laterally you have temporal lobe, and then in the vertex region you have the parietal lobe. Everything is on either side. You have frontal lobe, parietal lobe, occipital lobe, and temporal lobe. So you have two cerebral hemispheres, right and left. Both are connected together with the help of a structure called as corpus callosum, not dura mater. It is the outer covering of the brain. Okay, so corpus callosum, it is the structure which is connecting the two cerebral hemispheres. Okay, so now moving on to the specific functional regions in the cerebral cortex. Okay, so we have seen this is frontal lobe and the parietal lobe, occipital lobe, and temporal lobe. Now, based upon the functions, which lobe is involved in maintaining which category of function? So first in the frontal lobe, how you first differentiate between the frontal and the parietal? It is with the help of a sulcus. Sulcus are the depressions and gyri are the elevations which is present in our brain. We have so many sulci and gyri in our brain. This has been developed during the developmental process. In order to make the brain to be compactly fit inside the closed cavity skull, the brain is undergoing multiple invaginations. So that is giving you the sulci and gyri formation. Okay, so you have a major sulci called as central sulcus. So this central sulcus is the one which is giving you the division between the frontal and the parietal lobe. And the area which is before the central sulcus, you call it as post-central gyri, and this is the area which is before is the pre-central gyri, and this is the post-central gyri. So this part which is before the central sulcus, you call it as frontal lobe, and the one which is in close approximation is the motor cortex. And the rest of the frontal lobe, they are called as association cortex for the motor function. So on the whole, frontal is specifically for motor function. Okay, clear? If a person is suddenly hitting in the front forehead, then immediately after some time, if there is any cardiovascular abnormality, ischemia in any part of the frontal lobe, the person will have paralysis, because the motor function is lost in that particular area where the frontal lobe is hit. If by chance he is hitting with little force, whatever I said, it will happen. If the force is 10 times higher than that, then what kind of defect you will have? In which lobe you will have the defect? in the occipital lobe. Because of the force, this will have its reflection of the defect in the occipital lobe compression. Okay, if I'm hitting in my front head, then the posterior aspect of my brain will get defected, lesion, damaged because of the severity. Okay, so that way you have to analyze. If you are studying neurology, that is a very big concept. We don't want to go into neurology. We will study only neurophysiology, not pathophysiology. Okay, clear? So that is motor cortex, association cortex. And one more important structure which is present in the frontal lobe is Broca's area. It is specific for which function? Speech. And if there is a defect in this Broca's area, you will get aphasia. It is motor aphasia or sensory aphasia? Motor. Okay, and next coming to the parietal lobe, that is the area post central gyrus. Okay, central gyrus, posterior to it you have the parietal lobe. This is specific for somatosensory cortex 1 and 2, so it is also called as sensory lobe. And you have the associated structures for the sensory signal. And then moving on to the posterior aspect, occipital lobe. This is very important for the visual function. You have primary visual center, associated visual centers, everything. And the last one is temporal lobe. Okay, this temporal lobe is mainly responsible for what kind of functions? Just now I said occipital for vision. Temporal lobe, auditory, and also for emotional signals, emotions, limbic lobe is present. So you will also have the emotional functions. So in the temporal lobe you have auditory cortex, also you have the area called as Wernicke's area. Defect will also result in aphasia, that is sensory. Okay. And there is a structure which connects Wernicke's area with the Broca's area. What do you call that structure? Wernicke's area is for sensory speech, in the sense, for example, I am writing and showing you something and asking you to read. Your eyes is seeing. Okay. The visual cortex will give signal to the Wernicke's area. This will do the sensory function of receiving the signal. Instead of writing, showing, I am asking you what is your name. So your auditory function, it is giving the signal to the Wernicke's area and making you to tell your name. My name is so and so, you are able to tell. So both visual function, auditory function is having its neural connection with the Wernicke's area, sensing you what you have to talk. And then there is a fiber which is connecting the Wernicke's area with the Broca's area. This Wernicke's area is for sensory analysis. And Broca's area is for pronunciation of words, comprehension. If the Wernicke's area should analyze, they are asking me what is your name, so I have to tell my name. So that will give the signal to the Broca's area, which makes your vocal cords to function and resulting in the comprehension of words. So what is the fiber which is connecting Wernicke's area with the Broca's area? The most important fiber, arcuate fasciculus. Everybody has forgot that? Arcuate fasciculus. If there is any lesion in this region, you will get a condition called aphasia, that is specifically Conductional aphasia. Okay, clear. So aphasia is loss of speech. But whether it is sensory, motor or conduction aphasia, you should analyze. How will you analyze? For example, if a person is sudden complaint of stroke, paralyzed and loss of speech, okay, you have to find whether it is sensory or motor, which makes you to analyze which part of the brain is affected without radiological investigation. At least to some extent you are able to guess which lobe is affected. How will you assess that? And person experienced stroke and now in the hospital, and you are asking them, how are you? Are you fine? The person was able to nod the head. Yes, something he was able to nod. If you are asking, have you took your lunch or breakfast, and they are telling yes or no, some reply respective to the question you are getting. Okay, but he was not able to talk. So it means that Wernicke's area is normal. He was able to understand what you are telling. So Wernicke's area is for sensory analysis, understanding, receiving the signal and understanding what kind of question is being asked. Okay, and the motor area is the one which is affected, indicating that frontal lobe is involved in the stroke. So the person was not able to speak, but he was able to write and tell the answer. In the sense, understanding Wernicke's area is normal. Instead of Wernicke's area, if the frontal lobe is affected, Broca's area is affected, and you are asking them, hello, what is your question? And he will tell you, I saw you 2 days before, I saw you on that day. Something irrelevant answer he is giving. In the sense, Wernicke's area is not good. It is affected. He was not having the sensory signal. Understanding is lost. But articulation is there. It means Broca's area is normal. Okay, clear? So that is called as sensory aphasia and motor aphasia. That is how you will rule out the diagnosis in neurology with respect to the cortical structures. Understood? Yes? So now that is what given over here. Area 4 for primary motor cortex we have seen. From the place only the pyramidal fibers are coming out. So you know the functions carried out by that area. And area 6 also premotor area, which is in the association cortex of the cerebral frontal lobe. And area 8 in the frontal lobe for eye field. That is frontal eye field. This is responsible for the movement of eyeball. Just know the area number and its specific function. Okay, if you are able to identify the location, well and good. At least know the name and the number and the function. And area 22, Wernicke's area, specifically in the role of speech, understanding of auditory and visual information. This is sensory for understanding. And Broca's area number 44, 45. Remember 22 is Wernicke. Broca's area is 44 and 45. And this is mainly for articulation, pronunciation of the words. This is motor. Okay. And the prefrontal lobe, you have the association areas that is mainly for psychometric functions. Okay, if the person is having a sudden stroke, fall down from the bed or from higher region, and after that incident the person behaves like bizarre psychiatric, it indicates the prefrontal cortex is affected, that is responsible for the personality, intelligence, judgment and psychometric functions. Okay, after the Trauma, the person was showing psychiatric behavior, bizarre appearance. It means that prefrontal cortex is affected. So this is how you will identify the lobe involved in the defect. And then occipital lobe, one and only for visual function. The primary visual area, area 17, area 18 for association area, and occipital eye field for 19, 17, 18, 19 for vision. So up to this, the cerebral cortex is over.